Hello, everybody. This is Tamara Rawad, Dr. Washburn's teaching assistant. I'll be talking to you today about non-experimental quantitative design studies, and we'll try in this lecture to critically appraise this type of studies. So non-experimental designs may be used to investigate plight of clients or communities, and also to look at factors predicting process or procedure outcome, whether they are desirable or undesirable. It also can be used to investigate people's experience. And as I mentioned, it can be, or as we will learn, it can be qualitative or quantitative design. So how do we know prevalence, barriers to treatment, community challenges, and identification? So sometimes we use non-experimental designs to look at the prevalence of a disease or a problem in the community. So for example, here, how many people in this community have diabetes? We also use them to investigate barriers to treatment. So we would ask, for example, why aren't known interventions working on this particular population? We can also use this type of designs to investigate community challenges. So we might ask, what are the experiences of individuals with disabilities in this situation? We also use them for identification. For example, we might ask, who are the individuals most likely to develop PTSD after trauma? So we mentioned earlier that this type of design or the non-experimental design can be qualitative or quantitative. So what is the difference? In quantitative designs, we emphasize on precision, on the objective and statistical findings, in addition to generalizability of this findings or these findings to broader population. And in quantitative non-experimental designs, the data is primarily collected through surveys. And these surveys might include interview questions, like here, for example, how often do you have unprotected sex? How many people in your family completed high school? And it can be scales to measure some phenomenon that were developed previously and tested, and it was validated that these scales can measure a phenomenon. So for example, depression, anxiety, self-esteem. So there are some scales that measure all these phenomena or problems or issues. So when we want to administer these surveys, we can use, there's a lot of methods, like some of them are mailing the questionnaire face-to-face interviews, and also online. So when we want to critically appraise surveys, we should look and consider the following questions. The manner. So we would ask this question: was collection process valid and unbiased? Also, representativeness. So did the participant accurately represent the target population? Do participants look like the target population? Also, we will have to look at if the conclusions of the study were acceptable in the light of design, analyses, and findings. So the surveys we use should provide evidence that their measures were reliable and valid. So when we say reliable, that means that it's about, precision and consistency. Meaning, if we want to use this survey over and over again, it will give us the same results. When we say valid, we mean here, or we look at the meaning of the metric. So for example, when we say a valid measure means this survey or this scale measures what we want to measure. And this picture here explains it a little bit more. Also, when we want to look at the unbiased manner of the survey, we also want to ask if that survey was culturally appropriate and if it was sensitive to subtle differences in the sample. We also said that we should look at, or when we appraise the survey, to look and ask if it was representative. So that will be how well do the participants reflect the clients or context of our practice. And there are some problems that can limit generalization to broader population, and some of them are non-response bias and sampling method. And we will talk about these problems in details. Non-response bias. So even in best studies, response rate almost always is not 100%. Meaning if you send 1,000 questionnaire or survey, it's almost impossible to receive the same 1,000 or response from the 1,000 people you send that survey to. So that's why a higher non-response rate will give us, it can create a bias, because one of the questions that we might ask is, are non-completers different from completers in important ways? And that can be by, are they lower functioning? Were they less motivated? Do they have different experiences? Or did they have different experiences? And it's very difficult also to measure non-response bias. So, as I mentioned previously, it's very important that the response rate is very important, because it can tell us whether we have a problem or not. So, for example, response rate would that is less than 50%, that's suspicious. And that's because we have too much unknown information about that sample. And if we have a response rate that is more than 50%, that does not mean it's a representative. And that also means that there's no guarantee of representativeness, but it's more likely to be representative. So, which from this we can, see that the higher the response rate, the higher the representativeness. And also, regardless of response rates, researchers should attempt to describe differences between responders and non-responders. So, because that would, give it the reader or the audience an idea about the sample in general, or the population in general, and what are other things that the researcher didn't look at in that sample. And also allows the researcher to determine degree to which the responders reflect their clients. However, if a study has poor response rate, that does not mean it's unworthy. It can be used, in some situations. For example, here, low response rate in some of the studies, or in one study, but it shows high risk of suicide among elderly persons with Alzheimer's. So this is a huge or very important critical finding, although the response rate was not high. So we talked about the sample, we talked about response rate, but the very first step in this process is sampling. So we will define some terms here. For example, sampling is the way in which study participants are selected. Sampling frame is a list of names from which a study sample is drawn. The list may include the full population or just a segment of that population. When we say population, we mean the group of people to which the researchers seek to generalize their study's findings. And when we say a sample, that means a group of people who actually participated in the study. And that, okay, in this sample, that is the or include the participants or individuals that we will use their findings to have an idea about the target population, or who will be representative of the target population. So we have two types of sampling. We have probability sampling and we have non-probability sampling. Probability sampling is the best option for representative sample because it uses random selection to choose participants, and it's less vulnerable to bias or judgment errors. In non-probability sampling, no population list or sample frame exists, and the selection is not random, and research involves nature and impact of specific problem so that individuals without that problem are excluded. For the probability sample options, we have simple random sampling, systematic random sampling, stratified sampling, um, that can be disproportionate or proportionate, and we have also cluster sampling. In random sampling or simple random sampling, we decide on the number that we need for our study, and we select that number of participants randomly. For example, we write down numbers on papers and put them in a hat, and then we pull from a hat, or we use a random number table. We use a computer-generated list of numbers. In the systematic random sampling, we will select them each nth person on the list selected as participant. For example, every 20th person listed in a phone book, every fifth patient in a clinic database. So in this table, we can see that simple random sampling, we select randomly. And in systematic random sampling, we decide on the number. We decide the interval, and the interval is the number of cases in the sampling frame over the number of cases needed for the sample. And then we randomly select the first participant or the first number, and it will be the starting point. So for example, if we want 20 people and we have 100, so we divide 100 over 20, and that will give us 5. So from 1 to 5, we randomly, select one number, and then we'll add to that every fifth. So it will be first, and then let's say, for example, we selected, when we did the random selection, we got 2, so it will be 2, 7, 12, etc. In stratified random sampling, it's used to ensure adequate number of small population within a sample. So we divide them into strata or homogeneous groups. For example, social workers, 100, psychiatrists, 50, and nurses, 50, teachers, 50, and parents, 500, I'm sorry. And then we use simple random or systematic random sampling to select desired numbers from each category. In a cluster sampling, we begin with groupings or clusters of cases. We number each possible cluster and select random sampling of clusters. And then we draw random sampling of people within each selected cluster. For example, all cities in the United States with populations over 200,000 are numbered. Then a random sample of 10 cities is drawn. A random sample of 50 participants is then selected from each of the 10 cities. There are some potential bias in probability samples. Although it's typically less vulnerable to bias and errors in judgment than non-probability samples, it has two potential problems, which are poor response rate and also using a biased list to select cases. So the response rate, the bias and probability samples, there's no guarantee of 100% participation. Non-participants may differ from participants in important ways. The list used to select participants may not reflect the full population. So randomly dialing cell phone numbers will exclude people without cell phones, for example. The other part of sampling is non-probability sampling. So in this type, sample is not selected randomly. It's more vulnerable to biases or errors in researcher judgment. Resulting samples may not represent targeted population. No population list or sampling frame is available. Exploratory study needs sample with specific problems, and it's used in many studies, like experimental, quasi-experimental, qualitative studies. This type of non-probability sampling has different types. It has convenient, accidental, or availability. It has purposive, or judgment. It has snowball, and the last type is quota. In convenient sampling, we select cases that are most immediately available and convenient. So for example, sampling people who are homeless by surveying those who happen to be at a park on any given day. For example, so people available and convenient may, but one of the things that, or the biases that this type of sampling has is that people available and convenient may differ from um, those who are not. Also, studies using convenient sampling should be interpreted with caution. So when should we use convenient sampling? We can use them when internal validity is more important than external validity. For example, in experimental and quasi-experimental studies. And when access to participants is very difficult. So we want specific population, but if we don't use this the immediate convenient sample, it will be very hard to locate them later. In purposive or judgment sampling, in this type of sampling, it relies on researcher judgment about how to maximize the sample representativeness. So researchers may use their knowledge of different areas and times where different group of people who are homeless are likely to congregate. There's no guarantee that researchers' judgment is accurate, and it's somewhat stronger approach than availability sampling or convenience sampling. The other type is the quota sampling, and it's pre-established quotas. When pre-established quotas are used to sample specific numbers of study participants with particular characteristics. So for example, if a sample of 100 participants is sought, males and females may be recruited until 50 people of each gender are included. And also, it does not guarantee representativeness. In a snowball sampling study, participants identify other potential participants who are part of the target population. It is not random, and it is an acceptable method of surveying hidden or stigmatized people who are difficult to identify. For example, illegal or socially undesirable behaviors like drug use, other stigmatized characteristics like LGBT status. When appraising studies that use this approach, being asking whether the population was truly difficult to locate. Here we say, okay, that the point here is that when we want to evaluate this type of sampling, when we want to talk about the results in a study that used snowball sampling, the researcher or the author of that study or that paper should that population was very difficult to locate. That's why snowball sampling was used. Now we'll be talking about studies with time component. So we have cross-sectional studies, we have longitudinal studies, cohort or panel studies, case-controlled design studies. So when we say cross-sectional studies, we talk about studies that used to measure a phenomena at a single point in time. In longitudinal studies, we measure a phenomena at different points over extended time. In cohort or panel studies, we follow same set of people over time. And in case-controlled design studies, we collect data at a single point, but seek information about past events. So in cross-sectional studies, we don't assess change over time, and it has limited usefulness to establish causality or change. And inquiries about past phenomena may be tentative or of limited use regarding change. In case control studies, there are cross-sectional studies that ask about past events. So the same questions are asked of two groups of people who are similar, except for some contrasting outcomes. For example, military veterans who serve in Iraq with post-traumatic stress disorder are matched to similar veterans who do not suffer from post-traumatic stress disorder. And each group is interviewed about their military experiences to search for variables that differentiate the two groups. So for case control studies, there's some, biases that might uh, come up. So one of them is recall bias. Knowing how things turned out can, bias memory of earlier events. And also this type of studies has an issue with sample representativeness. And longitudinal studies, it's used to better understand or describe how phenomena change over time. It is less vulnerable to recall bias, and it allows tracking and analyzing of many different variables over time. In cohort or panel studies, they are longitudinal studies, and we use same set of people and we assist them at multiple times. It has better evidence regarding trajectory or causality. But some of the challenges with this cohort or panel studies are that there's some difficulty to track people over time, and it has high rates of attrition that might distort findings. For example, participant may die, change residence, or lose interest in the study. And some of the questions that we might ask in this type of studies is, was the sample representative or is the sample representative? And also the quality of statistics. So, and finally, when we want to look at the survey, after we discussed everything, previously, we will ask, were conclusions warranted in light of the design, logic, the type of data analysis employed, and findings of the analysis? Was the sample representative, like, the targeted population and the researcher clients? And if there was any sampling issue. I hope that you benefit from this lecture, and I wish you success and good luck and on your exams. Thank you very much for listening.